Hi, everyone. I'm Adriana Purcell. I'm a junior in the college, and I'm studying medical anthropology and Hispanic studies.
My name is Valentina Spadea, and I am a sophomore in the college studying anthropology and possibly English.
And we are both very excited to be talking to you today about some of the research that we did this summer and that we are continuing to do on the experiences of residents, business people, and healthcare workers of Cobbs Creek, West Philadelphia, with Doctors Francis Barg and Dr. Kent Brim.
We have been working remotely this whole summer on a project that we conceptualized in mid-April, right when the pandemic was really hitting its peak on the East Coast. And so we realized that there's not much scholarly literature on how the pandemic is affecting the human experience in historically underserved neighborhoods, especially because it's an ongoing situation. So we wanted to do some research into what it was like for somebody in a neighborhood like Cobbs Creek in West Philadelphia to be experiencing the pandemic.
Right. So, of course, our research methodologies this summer have been completely remote, which has come with its own limitations and lessons for us as researchers, and even for our, for our two faculty support professors as well. It's been a challenge, but it has definitely been a wonderful learning lesson. So we have done remote telephone interviews and also completely remote recruitment of our participants thus far, and we will continue to do so following UPENN protocol for this next semester.
And we've learned a lot through both the process of recruitment, which has been social media based and spearheaded by community liaisons working at the Sayre Health Center in Cobbs Creek. And we've learned that it just takes more time when it's all done online, because you really can't have that face-to-face in-person interaction where you're getting somebody to really believe in what you want to talk to them about. And I think we've had similar experiences with our phone interviews where we've realized that intonation is really important because you're losing a lot of the cues that are traditionally very important in an interview setting. So there's no body language involved, there's no facial expressions involved. So intonation and actively showing cues of engagement have become really important.
Right. And as we continue this, and as the world is kind of racing toward finding a vaccine for COVID-19, we just want to underline how important it is to constantly remember that although it is a disease, it does originate in humans, at least for the purposes of the pandemic that we're in right now, and that experiences definitely accompany the physical disease as well, making it an illness, which is an underlined concept in medical anthropology, which we love to always remember.
Yes, and we are really excited to be sharing this project, and it is ongoing. So we have a few intermediary findings, including that there are some new sources of emotional support being relied upon during this pandemic in the community. And there has been some new social meaning that has been garnered from what used to be very basic everyday experiences like using public transportation or buying groceries.
Right. And of course, Valentina and myself, we are incredibly interested in talking to anyone who would like to know more about this very captivating research that we've been doing for the past 6 months or so, and we continue to do. So please feel free to reach out to either of us or to Drs. Barg or Dr. Brim and to Sayre Health Center. And just as a larger thank you, we want to thank the Hassenfeld Foundation for allowing us this wonderful opportunity to kind of delve into the human experience during this unique and unparalleled time. And we also want to thank, of course, University of Pennsylvania. We want to thank CURF, Dr. Ann Vernon Gray for really putting this together, Ms. Jane Morris, the executive director of CURF, and of course the Penn Anthropology Department and Sayre Health Center, both of which we could not have done the study without.
Yes, thank you all very much.